Well, welcome everyone. My name is Dr. Claudia Alvarez. I am the co-chair of the Miami chapter at the National Hispanic Medical Association. Welcome everyone to our series for the Policy Summit for the National Hispanic Medical Association. I have the great honor to serve today as your moderator and to present Dr. Elena Rios, who is the founder of National Hispanic Medical Association, and Dr. Lorena Bonilla, who is a hospitalist and a faculty at Baptist Kendall Hospital and the FIU School of Medicine. So I would like first to thank everyone for coming to our, having Miami as one of the chapters, hosting one of the policy summits. And I would like to tell you the name of the presentation today. It is Physician Activism, Detention Center, Medical Care, and Empowering Youth. So this is going to be one of the many series in our policy summits, and we're very happy that Miami is hosting one this year. Last year we were not able to host one, and we hope that this will be the beginning of many other events in Miami. And when coronavirus is no longer with us or more under control, we'll be happy to have many of you and many more Miamians and Floridians to join us at our events to continue gathering us and improve our networking and our coalition as physicians as part of the National Hispanic Medical Association. So without further ado, I would like to first introduce our first speaker. Oh, no, before that, I would like to let you know that by you participating in this chapter, in this event today, you will be eligible to receive CME credit. This CME credit will be valid for 1 year. And in order for you to claim the CME credit, you have to go to the website. And as you can see, is 1.25 AMA, PRA Category 1 credits. So not only are you getting wonderful and fruitful information on how to be an amazing and excellent physician advocate for our community, but you are also acquiring credits so that you can continue with your license and your board certification. So then now would like to present our wonderful founder for National Hispanic Medical Association. Just a little fun fact, if you haven't heard from Dr. Elena Rios, and if you have not heard about the history of National Hispanic Medical Association, it started in 1993 from the first White House meeting when Dr. Elena Rios was working as a physician in the outreach program for the Human Health Services during the Bilton administration, recruiting not only physicians, but other healthcare workers and Hispanic healthcare workers and physicians to be able to provide input on the healthcare reform that our country much needed and still needs. So in 1994, they formed their first board of trustees. And now almost 30 years later now, we still have our wonderful National Hispanic Medical Association. And I would like to then have Dr. Elena Rios start. And again, thank you for being part of our Miami chapter event. And we will start. Thank you.
Great, thank you, Dr. Alvarez. I think it's a privilege to be with you and discuss the importance of physician activism and youth. And I know you're going to talk about the importance of the detention centers, but I just wanted to bring up a couple of other things first. One is that we have a role as physician activists to tell our patients to get involved in research. And you know, a lot of people don't understand the importance of knowledge about our own people. And there's a very important COVID vaccine clinical trial happening. There's several clinical trials happening But if we have Latinos within the studies, we will have more information about our own Latino people. And, you know, it's always good to be able to have knowledge that is unique to our communities. So we have here two different websites. The first one is coronaviruspreventionnetwork.org, and that is the website of the National Institutes of Health that is working on the clinical trial with Moderna. The second one, covidvaccinestudy1.com, is the Pfizer clinical trial. Both clinical trials, Moderna and Pfizer, have already recruited half of their target numbers of 30,000 people. And Pfizer's actually already asked for an emergency approval in November, probably by the middle of November. There are other companies like Sanofi, Johnson & Johnson, the Janssen part of Johnson & Johnson, and other companies that are having a slower start, but they are also going to be recruiting people, and NHMA believes we really need to support research so that we can know more about our own communities. In terms of our other invitations to invite everybody, these will be virtual events this year. We have a scholarship program out of our foundation, and that scholarship program will be November 19th. It is a ceremony to give awards to about 22 new scholars who are students in medical school, dental, public health, nursing, pharmacy, and physician assistants. And we also will be giving awards to some leaders, including Dr. Eduardo Sanchez, who's from the American Heart Association, and others. And that is our link right there. And the website is NHMAfoundation.org. And it will be free. And we're asking for donations. And it will only be 2 hours, an hour reception with networking, and then an hour of awards. The other event is our national conference. The conference will be March 17th through the 20th. It will be virtual. And I want to let everybody know that we are looking for speakers this month, and hopefully we'll finish the agenda. And we are also looking for students and faculty to have posters on Latino health and issues around service learning or research. And again, our website for the NHMA is nhmamd.org. So I have a very short survey that we would like everybody to answer. First, we're going to show the survey on the screen. Vincent is our staff today, and Ben Milano. And okay, here's the first question. And if everybody can please help us with the survey, we're very interested in getting some information for Pfizer's Multicultural Center of Excellence, who's our sponsor tonight. The number one, have you ever experienced racially charged actions, derogatory language or discriminatory behavior, stereotyping, hate speech, even if subtle, at any point in your medical career, including while in medical school or residency? And we'll give you a minute to fill this out, and then we'll show you the results. So can everybody please press yes or no, and then submit at the bottom. And it's only 4 or 5 questions, very, very brief. Oh boy, okay, 93% said yes, not surprising. Okay, next question. Have you ever witnessed racially charged actions or discrimination against patients while seeking or receiving care in a health institution? So in your medical school clinics, on your rotations in hospitals, in your medical practices, in clinics, have you ever witnessed racially charged actions or discrimination against patients? And please answer yes or no and submit. Vincent? That was the wrong, okay. Well, that was the first one. The second, did you put up the second one? Okay, it should have been that should be number 2. Can everybody see this? This is the second question. Have you ever witnessed racially charged actions or discrimination against patients that are seeking or receiving care in your institutions? So just press yes or no and submit. Okay. Okay, and that one also had a large 88% yes, 13% no. Okay, the next question. From your experience, in which industry area would ending racism make the most impact on patient care in the short term? And I will just say that short term could be a year or 2 years, you know, but what we're asking for is something that could happen with the decision makers within this institution. And choose only one. So if you can choose one and then submit. Vincent, you're going to have to scroll down because you can't see the last answer. Vincent? I don't know if you can hear me. Okay, well, it looks like a lot of people thought insurance was the important industry that could change racism and have an impact on racism. That's kind of interesting. And then right next to it would be healthcare. Okay, the next question. In which of the following areas would you like to see the pharmaceutical industry focus diversity and inclusion efforts? And pharma companies are the companies that have scientists and government affairs offices and also executives who have to supervise everybody. But lots of jobs in the pharmaceutical industry, but what area do you think should focus more on diversity and inclusion efforts? And you can answer, you know, one of them, or at the bottom it says all of the above. And then press submit. Okay, all of the above. Okay, and then there's one last question. And this one, we want you to answer it in the chat box. At the bottom of your screen, there is a chat box. Vincent, can you? The question is, please suggest one way in which you would disrupt systemic racism in healthcare. And if you could just be brief in your answer think about the questions that we just discussed. Please suggest one way in which you could disrupt systemic racism in healthcare. You might not work in a insurance or pharma industry. You might be working in you might be a student in a medical school or a resident. You might be a doctor within a hospital or a clinic. But how could you disrupt systemic racism where you are? And please type them in the box. I'll answer one. Okay, just go ahead and answer. I know there's a lot more people on the phone. I'm going to read a few of them. One says, working within my system by increasing workforce diversity and patient access. As a hospitalist or as a leader? If I was a leader in my hospital, I would require intense bias training. And that's a good one. We have to remember that not everybody comes from the same background and has a lot of stereotypes about different people, especially Latinos or African Americans. Using my privilege and speaking up when I see racism playing out in the system. And someone else has education. We need more education. Another answer was really just suggesting to Congress to make new policies that will increase Latino funded programs and have better access to jobs and programs. And I'll just read one more. Calling out racial terms, biases when they are said out loud. Okay. Okay, well, I'll just stop there. We just did this to get everybody thinking about how important your role is. This is really about activism today. And I have a few slides about being active with youth on a campaign that we call Stop Vaping campaign. The reason I wanted to provide this is because the NHMA organization and our foundation, which is National Hispanic Health Foundation, was given a 2-year project by the Aetna Foundation to call for spokespersons from among our doctors and medical students to talk to middle school and high school kids. We need to be active. We're going to hear from Miami doctors about how they're active. The program has a hashtag, Vapor Not Safer, and we have three-pronged approach, a social media campaign aimed at middle school and high school students with fact sheets and videos. They're on the NHMA website, and our focus of social media is Snapchat and also Twitter, and Instagram. But our focus group of middle school and high school kids said we should use Snapchat and get young people, especially young medical students and young doctors, to start talking to them about the facts. We have resources for parents and we have resources for healthcare professionals. And we really need more spokespersons. We welcome you to help us over the next year. Next slide. So in 2014, the Surgeon General produced a report on e-cigarettes. It was the first time a call for action that summarized what different stakeholders could do: parents, teachers, healthcare professionals, even state governments and communities. And this was addressed because e-cigarettes was a brand new public health epidemic. And according to the National Youth Tobacco Survey, past 30-day use of e-cigarettes increased 78% among high school students and nearly 50% among middle school students from 2017 to 2018. In 2018, more than 3.6 million youth in the United States were current e-cigarette users. In 2020, almost 20% of high school students, 3 million, and almost 5% of middle school students, another 500,000, reported current e-cigarette use, according to the CDC. So that's why NHHF has been supported for this 2-year campaign. We launched it with a congressional briefing with the current US Surgeon General, Dr. Jerome Adams, in July, and we've been developing everything that's now on the website with our advisory committee. Next slide. Smoking kills more people than alcohol, AIDS, car accidents, illegal drugs, murders, and suicides combined, with thousands more dying from just spit tobacco use. And you know, it's just important to add that we have a lot more vulnerability if we smoke or if young kids start vaping because of the nicotine affecting their immune system and all the other bad chemicals that are in the vaping products, especially right now with COVID-19. Next slide. So just some fast facts. I won't read all of this, but high school students just in the past month, 2019, 800,000 high school students who are current e-cigarette users in 2019, 30%. And I think it's just important that we be able to tell the young students these kinds of facts. This is what our social media campaign will be. Kids under 18 alive today who would ultimately die from smoking is about 6 million kids. Next slide. So what is the appeal? The not regulated and not FDA approved to help adults with tobacco cessation, having long-term effects that are unknown. We don't know about the link to heart attacks, high blood pressure, coronary artery disease, harming lungs, asthma, popcorn lungs, and increased coughing. All of these things are important to know. That's why we want to stop vaping now. The particles in vapor could lead to heart disease, asthma, stroke, and diabetes. And if you don't smoke, why start? Tobacco users right now die 14 years sooner than non-users. Okay, next slide. So this is some of the branding and mischievous marketing coming out. Vaping companies are frequently targeting these youth, middle and high school kids, students. They use kid-friendly marketing, advertisements, social media, all of the flavors that were in vaping. FDA this year just recently banned that. And right now, there's over 400 brands with 84% fruit flavors and candy and sweet flavors. Next slide. It's just water vapor is one of those common things said among students. And these are the ingredients. It's not just water. It's aluminum, it's lead, it's arsenic, formaldehyde, which we all know is in our anatomy labs, diacetyl. And I think what's important is that all of these chemicals taken together are worse than just smoking a cigarette. People do not realize that this is really worse for your bodies, for your lungs, for your brains. Next slide. So vaping and COVID-19 can cause, like I said earlier, much more vulnerability. It weakens the immune system, it targets the lungs, and we know COVID-19 is a respiratory disease. Nicotine side effect also has more shortness of breath and has been linked to heart attacks, high blood pressure, harming lung tissue, asthma, etc. The particles in the vapor can lead to these problems also. And it's really important more than ever to protect youth from the harms of vaping and stop them from even starting the habit. And again, NHHF welcomes spokespersons for this campaign. It's an example of how you can be an activist and you can help improve health in our communities right now. We have video messages that we're asking our doctors to develop for 30 seconds to be able to put on social media. And if you're interested, contact our Our office, our email to NHMA is nhma@nhmamd.org. Next slide. And then resources for parents. We've got a lot of those, especially on how parents can talk to their students, talk to their children. And I think the main message we have is to be willing to listen, avoid judgment, but come with facts on how important it is to understand the harm you're giving to your body when you do vaping. Next slide. Resources for health professionals. Again, we have fact sheets. We have the report from the Surgeon General. And I think lots of free tools from our advisory committee, which are all involved in education of middle school, high school students, and working with other institutions like Free Tobacco Kids and the FDA. And next slide. I think this is the last one. This is the last one. So join us in the fight against teen vaping. This is our social media campaign. And again, our hashtag is Vapor Not Safer, or NHHF Stop Vaping. So I want to thank you very much. I think that's the conclusion of my presentation. I want to turn it back to Dr. Alvarez, who's the chairperson for the Miami chapter. And we're very happy to have you be our leader and you know, get all those Miami activists together. So take it away.
We're certainly trying. Thank you very much, Dr. Rios, for that wonderful presentation. I actually would like to share that in 2015 and 2016, I was also part of a campaign against tobacco and tobacco products, which included vaping, in Proposition 65 California amendment that was going to be voted by all the registered voters of California. And so that's why I encourage everyone to continue using their power and their knowledge against vaping industry and tobacco, which indeed kill more people than anything else in the country. And here in Miami, South Florida, specifically, there is a much higher percentage of users of tobacco. So Miamians, South Florida, and Floridian physicians, don't forget to ask about tobacco smoking, tobacco products, and against vaping. Okay, now I would like to transition to our other magnificent tool that we can use as physicians, which is our position of privilege. Physician advocacy for people in immigrant detention centers. I would like to introduce Dr. Lorena del Pilar Bonilla. She is a board certified internal medicine physician and an assistant professor at the Florida International University School of Medicine. She works as a hospitalist in the West Kendall Baptist Hospital and serves as one of the teachers for the family medicine residency program. She's also an advisor to the regional LMSA, the Latin Medical Student Association Southeast Region, and is one of the co-founders of Doctors for Camp Closure in Florida. She is also an avid and passionate activist here in South Florida, a leader in the region, also my esteemed colleague and friend. Without further ado, Dr. Lorena Bonilla, please enlighten us with your presentation and inspire us. So we are going to ask Dr. Bonilla to unmute herself.
Oh, okay, thank you. So thank you, Dr. Alvarez, for that introduction. I'm going to talk about COVID-19 pandemic and immigrants in detention centers. Since the testing for SARS-CoV-2 began in February, thus far there's been more than 5,300 people held in U.S. Immigration and Customs Enforcement custody that have tested positive for the virus. And over 800 were still in isolation or under monitoring by the end of August. Next slide, please. Some background information regarding the legal bills that have been in place, or acts. One of them is Reno Vs Flores. Two organizations at the time had sued the government regarding the treatment of children at detention centers. This resulted in the Flores Settlement Agreement of 1997. It established regulations and minimal standards for the detention and treatment of minors by federal agencies. Next slide, please. These include that children must be held in the least restrictive environment. It specified that the maximum time that these children can be held in prison-like condition is 20 days. It also requires the detention centers to be safe and sanitary. Next slide, please. On this slide, you will see that there's a variety of medical organizations. This is just a basic. There's more than these to add. Some relevant organizations here are the American Medical Association, Doctors for Camp Closure, and National Hispanic Medical Association that historically have made statements regarding the treatment of families in regards to family separation and being an advocate for them. Recently, the news reported about hysterectomies being performed at the Irwin Detention Center in Georgia. NHMA, as well as the American Medical Association, they called on the U.S. Department of Homeland Security and the Office of Inspector General to thoroughly investigate complaints about detained immigrants, reported allegations of medical procedures being performed on individuals without their proper obtained informed consent. Doctors for Camp Closure has been working with lawyers in the Georgia hysterectomy cases to review medical records and give congressional briefings for them. Congressional representatives visited the Irwin Detention Center on September 2020. On October, the House voted and passed Roll Call 217, Resolution 1153, and it essentially condemned unwanted, unnecessary medical procedures on individuals without their full informed consent. In 2019, U.S. District Judge Dolly G. in California authorized an appointment of Dr. Paul Weiss as medical oversight. Dr. Paul Weiss is a professor of pediatrics and health policy at Stanford University. He was able to conduct an inspection of U.S. Customs and Border Protection facilities and assess the health conditions for detained children. After touring the border detention centers, Dr. Weiss described how children were kept, and he coined this term, kind of cage-like processing center. This photo here is a trip that I took on a trail at Zion National Park. On the left, you can see this very thin outline. It's about 1,000 feet above, and the width is only about a foot or so for you to be able to walk. It's a very steep trail. And at the time, it was during the summer. It's one of the deadliest trails, by the way. It's called Angel's Landing. A lot of hikers like to hike this trail. It was a moment where I reflected on the journey that immigrants take, that are leaving their lands. They're being persecuted. They're running away from violence, political persecution, and their journey is a difficult one and dangerous one. Similar to this, but I have the privilege of having commodities and to ensure that my trip is safe. So this journey is a reminder to me why I went into medicine, and I became a doctor to use my empathy to help people on an individual level as a doctor, but also as a public health advocate. So one organization that I worked with was Doctors for Camp Closure. This organization was founded July of 2019 by 3 women physicians, Dr. Danielle Danis from Virginia, Dr. Bonnie Arzuruega from Massachusetts, and Dr. Mary DeLuca from New York. It is a nonpartisan organization of over 3,000 physicians and healthcare professionals from all specialty who oppose the inhumane detention of migrants and refugees. On October 2019, hundreds of doctors participated in a march to the White House to demand an end to Trump administration's inhumane treatment of migrants. The position statement of this organization includes the immediate end of use of detention, the immediate end of family separation, the immediate implementation of an independent medical oversight to ensure standards of medical care being met, the immediate end of dangerous deportations. There is a strategy involved. There's an inside approach, which involves lobbying with state leaders, Congress, senators, and presidential candidates. The outside approach are events that bring public attention via marches, rallies, and protests, writing opinion articles, using social media, coalition building, which involves volunteering our medical expertise to immigrant advocacy groups. On this slide here toward the left, there is a banner for the march that happened in October of 2019. Many physicians took some time off from all over the country, Texas, California, Arizona, to go to Washington, D.C. for this. And on the second banner, this was recent, this was in May of this year, we held a 24-hour vigil across many cities across the United States to highlight the issues of inhumane detention and the risk of people being in these detention centers. So I'm going to give a few samples. This list, again, is not exhaustive. It's limited for time's constraints. I'm going to focus on Florida, Maryland, Oregon, Pennsylvania, and a chapter in New York, because they have several chapters, one being Sacramento. So our chapter here in Florida was created January 14, 2020. I had the honor and happiness to have Dr. Claudia Alvarez be the co-founder with this. We have a small membership, 20 members thus far. We have physicians who are concerned about the health and well-being of immigrants. Some of the activities that we have done here locally in Florida include the following. We submitted a letter to the ICE director asking for the release of people in detention centers. We published an opinion article in Miami Herald. We had a second opinion article published with the support of the Committee of Interns and Residents. We had a letter that was signed by the members and sent to our governor requesting the release of people in detention. We have participated in marches and have been interviewed by the news and have been presented in newspapers. On August 25th, there was a roundtable meeting with Florida Representative Debbie Mukasel-Powell, and the representatives gave a firm commitment to do unannounced inspections to stop the transfers of immigrants between one detention center and another. Here's a photo of, right there, dead center is myself, and then we have Dr. Franklin de Rocha to my right, and Dr. Alvarez right on the front. This is some of the activities that we were involved to get the release of the detainees at this particular detention center. One important thing that we do, we don't work alone. We collaborate with different immigrant advocacy groups in the region. Some of them are included here. United with Dream, Florida Immigration Coalition, Immigration Action Alliance, South Poverty Law Center. So we provide the medical expertise, and we're working with lawyers and just collaborating with what they need as well. Here we have one of the, right on the front is Tomas. He's part with United with Dream And we have another physician, and Dr. Claudia Alvarez is hiding right there in the back. She also was there at the press conference answering questions and making a case why we should be releasing detainees during the pandemic. One tool that we did use, and it's used throughout the country in this organization, are putting posters or banners on a car and then driving around the streets to get people to see. This is part of the outside approach. And that's what you have here. It says, Doctors Against Detention, free them all for public health. This is the chapter's work in Maryland. They have had local protests against ICE detention. They have testified in their state legislators against the detention of immigrants. They have about 40 members. They have used letter writing campaigns that have resulted in getting many detained immigrants released during COVID pandemic. They work with partnership with local immigrant justice groups like La Casa, Sanctuary DMV, and United with Dream. This is the example of outside approach to get attention. We use banners, we use social media. The Doctors for Camp Closure in Oregon, they have written medical expert letters for a young man recently detained about the medical aspects of her case. They have done some work for a young man released who was in Colwich County Jail as he was turning 18, so he would not be sent to Tacoma. He has been released. They met with La Resistencia and they requested help for reviewing some medical records from Tacoma and writing up reports. This group, they also wrote letters to the governor so that Oregon would develop the Oregon Workers Relief Fund. This money supports people who do not have access to unemployment. This is specifically for undocumented. This has had two funding by the state for a total of $20 million, and to date, $10 million have been distributed. They worked on the National Doctors for Camp Closure action with the vigil at ICE Center in Portland. They were on the local news related to this effort. Doctors for Camp Closure in Pennsylvania, they collaborate with New York lawyers for the public. And they advocate for the release on medical grounds. They have a network of about 20 students who write the first drafts and then 10 attendings who sign off. Organizations that they work include New York Lawyers for the Public Interest, local immigrant interest rights nonprofits, Casa San Jose, for example, and they participated in the Berks Detention Center protest. Doctors for Camp Closure in Sacramento was started by Dr. Ian Kim and Dr. Kumar in 2019. They are the first local chapter. They have monthly meetings held in Sacramento, and they have political development and education through their meetings. They have about 20 members at each meeting. They're engaged with each chapter, 40 to 50 who have participated at some point. They also have a medical student interest group, Doctors for Camp Closure at UCD School of Medicine, which is now affiliated and anticipated to have many members. This slide kind of highlights more advocacy from the chapter in Sacramento. And in 2019, they participated in a flu vaccine for migrants in San Isidro. In January, they did an asylum evaluation training with the Highland Northern California Human Rights Clinic and was co-sponsored by Doctors for Camp Closure. On April, they did a card rally at Yuba Ice Center to free them all. Further that month, they did another car action at Croker Park. In May, they did a caravan for immigrant rights. And in May, they also were one of the chapters that participated in the 24-hour vigil at Yuba County Jail and ICE Detention Center. They have participated in various online digital actions supporting local and national campaigns. Collaboration with immigrant advocacy groups is very important. And here are some of the advocacy groups: the NorCal Resist, Northern California Human Rights Clinic, Decarcerate Sacramento, Yuba Coalition to Free Them All, UC Davis School of Medicine, formerly 193 in ICE detention at Yuba County Jail, ICE detention facility. The majority have now been released, and this has been achieved with coalitions. Doctors for Camp Closure co-sponsored the first asylum evaluation training for healthcare professionals in Sacramento, with plans to bring additional trainings. They submitted and passed a resolution to close the camps at 2020 California Academy of Family Physicians all-member advocacy meeting. This resolution is now being developed further in subcommittee. Now, we're actually here in Florida are going to be implementing this resolution and trying to take it to our Florida Academy of Family Physicians as well. So here's one question. What advocacy efforts have physicians in the community taken up to address people held in detention centers during the COVID-19 pandemic? A, letter writing to state medical organizations to provide resolutions. Attend press release to bring awareness to the community. Write opinion articles to media and medical journals, and serve as a medical expert. E, all of the above.
Feel free to write your answers in the chat box comment.
Yes, right? Very good. That seems like the right answer. Yes, good. So I do have a parting thought. I'm going to end with this quote. It says, every moment is an organizing opportunity, every person a potential activist, every minute a chance to change the world. And the picture here is a gentleman whose son was held at Broward Transitional Center for a year. He was in his early 20s, the son. And after he worked with some local advocacy groups and a lot of work involved on his end, he was able to get a humanitarian release of his son. And we're all very happy for him for that end result. Here is my contact information if you have any more questions. It's Bonill, BONILL07@gmail.com. Thank you so much.
Thank you so much, Dr. Bonilla, for this wonderful and inspiring webinar and presentation. I would like to ask right now the participants to ask questions. Feel free to ask some questions that may be itching you to ask. First, actually, let's start with myself. So, Dr. Bonilla, I really would like to know what healthcare violations have been reported to take place in detention centers that put the public health at risk.
Thank you for that question. There are some reported health violations, one of them being family separation, which creates childhood trauma and also adverse childhood adversities, experiences that will have negative impact on their well-being, as well as reducing their lifespan and cardiovascular health. There's detention centers have been known to be called like the ice box because they're held in very cold conditions. There was a report from the Department of Homeland Security that found them to be dangerously overcrowded and prolonged detention in these facilities. There's lack of showers, lack of standing room conditions, and lack of hot meals being provided.
Thank you so much, Dr. Bonilla, for that answer. I do have other a question, which is how can a physician use their role to prevent outbreaks during a pandemic in our communities?
So when you see something and when you learn about it, you should speak up. If you're a witness, take it a step further and use your knowledge and your advocacy to speak up. You can also volunteer your time to become a medical expert and work with advocacy groups to review medical records and write an opinion about it. You can communicate your concerns to Congress. You can call your public officials and share your concerns, especially now that through the pandemic that we're holding immigrants in confined spaces where they cannot do physical distancing. So you can share these concerns with your local health officials and people in government. You can also join medical organizations and especially organizations like National Hispanic Medical Association that have been an advocate for the Latino community. And then if you belong to any subspecialty like the surgical or OB-GYN or any other subspecialty, if they're not addressing this issue, you can be a spokesperson for that.
Wonderful, wonderful, absolutely. And so, you know, in this day and age, sometimes us as physicians, we feel like we don't have enough power or authority, autonomy, etc. And then we forget that we actually have power and we have privilege, that we have a name and a place, a position in society. So can you tell me, Dr. Bonilla, what are some of the unique characteristics and factors that a physician carries that can give us credibility and authority to call for action when it comes to our communities marginalized, such as the immigrant communities or detainees that are at detention centers?
Well, we have the opportunity to learn and be in touch with what the science offers and be informed about the conditions where this virus thrives. So as we hold our medical knowledge, we are also called to educate. So not only do we have a duty to take care of patients, as I said earlier, on an individual level, we're also called to action to educate our community, educate citizens, as well as public health officials to help take care of their health. So that's you know, and then in terms of the character that doctors have is we should have those qualities of empathy, compassion, and caring.
Absolutely. Yes, I perfectly agree with you. Now, we do have a question from our participant.
Sure.
Franklin Rocha Cabrero is asking, Dr. Bonilla, I have a question with strategies we can use to coalesce with other local and state organizations within our community. Any advice on that you can give the attendees on how to mobilize other organizations?
So I would say if you are interested, you should learn about what organizations that you're affiliated with to see if they have an advocacy arm and be involved that way. I believe the NHMA has a policy advocacy arm, so certainly I would engage with that organization, NHMA. You can also look at Doctors for Camp Closure and see if they have a state chapter, and if they don't, you can certainly become your own leader in that chapter, in that state, and start it. This is all volunteering. You're volunteering your time on an issue that it seems to be important for you. So that's the strategy that I would use. And the more you learn, the more it becomes easier for you to educate and promote and get other people involved.
Thank you so much. And I have a follow-up question also from Dr. Franklin Rocha Carrero. This will also apply to all our physician attendees or being invited to speak in media, or who they invite themselves, because you can also, as a physician, invite yourself to the media to talk, give us a short segment. Actually, most radio stations, TV stations, and media outlets will be more than happy to give you a segment if you want to speak out on any issue, and specifically the immigrant community and detainees. So what advice would you give us in terms of engaging the media in a way that is impactful for our patients who are detained? Some tips on how to speak in the media.
Well, so there are immigrant groups that have affiliations. They have contacts in terms of reaching out to get a press release. If you conduct some kind of like a protest or a rally, with COVID now, you do have to do it with a precaution, wearing your mask, doing physical distancing. We have social media available to send a message to someone, to email somebody from the press. You can look up your local radio station or a news channel and find the editor and send them an email or give them a call. There are ways to reach out to them, and you share your position, what you would like to share, and see if they have an interest.
You know, Claudia, if I could just answer about NHMA, I know it was brought up. We have an advocacy office, and Ben Milano is our government affairs staff. You know, I've been in government and worked with the Congress, especially the minority caucuses, the Congressional Hispanic Caucus, Congressional Black Caucus, Congressional Asian Caucus, and they come together every Congress, every 2 years, and create their own bill, which is a placeholder bill that's a minority health bill. And it has gotten bigger and bigger and bigger over the last dozen years that they've been working together. But I think what's important is whatever strategies and information that you would like to have us add in terms of detention centers, we'd be happy to. So we primarily focus on issues like how to have anti-bias training and cultural competence, how to increase the number of underrepresented students in the health professions, how to build more scholarships, more loan repayment. But there's lots of parts of this bill, like the offices of minority health were in this bill, insurance reform was in the bill, and a lot of the things that the minority caucuses, and I mean minority, I mean racial, ethnic minority caucuses, they come together, and when there's a big healthcare bill, they try to add some of the information that they have already agreed upon as important and put it into the mainstream Congress bills. And I think that the Homeland Security Department has different advisory committees. I participated on one advisory committee that was put together when a man from, and I don't remember what country, Mexico or Latin America, right, died of a heart attack. And there was a real big brouhaha about it. And it was under the Bush administration, the Bush Jr. And I was asked to be a part of this committee. And because they wanted to have a Hispanic doctor involved in the committee. And I talked to them about the class standards, the culturally and linguistically appropriate standards of the Office of Minority Health. And you'd be surprised, the Department of Homeland Security doesn't know anything about what HHS does. They're all siloed. And so it's important for doctors that have an interest in public service and an interest in making changes from the inside, becoming part of advisory committees. Another example, and I'll just say this, I'm on a committee for the Veterans Administration on medical education. Who would know that there's, I mean, all the veterans hospitals that teach our medical students and residents are connected to our medical schools. And they are very interested in having more diversity in their training programs too, just like everybody else, because there's such a, you know, the browning of America is happening right now. And in our lifetime, in the next 20 years, 1 out of 4 Americans are going to be Latino. So we have to start really having a bigger voice and standing up for are people that are in these detention centers or are being, losing their jobs because they're the essential workers in our communities. And I think that we do need a better strategy on getting into media and being proactive. And I'd be happy to help with the Miami chapter or other doctors and leaders in our chapters who want to get more involved in media as a group, saying the same thing, having more of a campaign effort. I was talking to one of our doctors, Elon Shapiro, out in Los Angeles. I was there last week. And he was saying, we should make more statements and then have all the doctors echo the statement in terms of what's happening in the news to our communities and get more doctors connected in media, radio, TV, in a more proactive way. And I think that's where we're headed in terms of our media presence. We're doing a lot of social media, but we need doctors, like I said, for vaping to be spokespersons. We need doctors to do little videos that we can get out. We need to do podcasts. We need, and anyway, I just welcome your enthusiasm and thank you for everything you're doing in Miami, but we do need to do more instead of talking to each other, and we need to get the Latino medical students and the Latino residents to work together too, because it's important that they learn and get mentored so that they become the leaders of the future.
Thank you,
so
Dr.
much,
Rice. Mm-hmm.
Dr. Rios, for those wonderful and powerful words, and you being in the front lines and you being within the system. And as you said, we need our Latinx physician community and minority community to want to change things within the system.
Mm-hmm.
And now we know that we can go to you in order to have guidance and to lead us in the right direction. And this is exactly what I was going to ask is these examples and these opportunities that you're stating. You're inviting us to become more involved with you, getting involved with NHMA and getting in touch and in contact with you so that we can partake in these opportunities as well, correct?
Definitely, that's what our membership is all about. In fact, we have a brand new website for you to know and for you to think about using. If you're a member, and if you're a resident member, or if you're a doctor member, or if you're an associate member, somebody that's not a doctor, who believes in our mission of improving the health of our communities, you have access now to form your own, what we're calling communities, through our databases. We have 25,000 professionals and students on our database right now in our website that we are opening up for the first time so that we can start generating more networking. We have the databases of the 50,000 Latino doctors around the country, but it's hard to get them engaged if they don't know somebody. Everybody gets isolated. So the more you do networking through causes that matter to you, and you find others that are interested in the same cause, you generate a support group. That's so important as you move in your career. You're always going to need to call on somebody to help you do something that might be a little different, but the problems are going to stay the same. The Latinos not having enough in our communities, and there's always going to be an issue where you're going to have to find people that understand the issue, but other people that are the leaders to bring people together. So I think this is great that you are looking at how to get physicians more active around the detention center problems that have become horrible under this administration and are not going to go away overnight. So we definitely need your leadership, continued leadership, Dr. Bonilla and Dr. Alvarez, and all your colleagues.
Correct. Thank you very much. This is a call for all physicians and all non-physicians that, as Dr. Rio said, believe in our mission to empower the health of the Latinx community and the minority community to come and join us in this effort, especially if you are in South Florida and Miami area. And this is a call for you so that you become part of us and become a network and towards each other. You are not alone. We are not alone. We have each other, and we have the same common goal, which is to decrease the suffering of all our community members in an equal manner. So I would like, anything else you would like to say, Dr. Bonilla?
My last words are thank you so much, Dr. Rios, for this opportunity to share our advocacy. And we look forward to future collaborations. So thank you very much.
Definitely, and for all the audience and those listening on Facebook, the National Hispanic Medical Association was started to be able to support our members and helping them in their careers do more for our communities. So we definitely are interested in more activist members, more activist doctors and nurses and others. And I just say that I want to thank Dr. Alvarez especially and Dr. Bonilla. Your information will be on our website. This recording will be on our website, and you can get CME for listening in. Also we have 17 chapters now, and all of them have had this type of policy forum, and all of them are on our website. So we encourage everyone to share and get involved. Oh, here's the, this is the next one. Dr. Alvarez, you want to take over? I know you're the moderator here.
Absolutely. Thank you, Dr. Rios. Yes. And closing remarks also, would like to remind you that this policy forum is still going on. And now we're traveling to the other of the coasts of the country, which is beautiful California and the West Coast. From east to west, we take over the whole country. So Northern and Southern California chapters will present COVID-19, heart disease, and healthcare workers 1 week from now at 6 p.m. to 8:15 p.m. Eastern Time. We have wonderful speakers that are also leaders in our community, very active. Dr. Maria Carrasco, Dr. Kimberly Chen, Joaquin Arambula, Marco Mijic, Jeffrey Oxidine, and our wonderful moderators, and also my friends who I know, Dr. Margarita Loeza and Ilan Shapiro, who Dr. Rios mentioned in this presentation already. So it'll be the same link, it'll be the same Facebook Live event, and it'll be the same energy and the same motivation in fund of knowledge also for all of our physicians in NHMA. Again, thank you very much. And all of our physicians, specifically now in the Florida chapter, South Florida chapter, even if you're not in Florida, but you know someone in Florida, we need you. We want you. Join us. Be part of our network. Be part of our team. United we stand, and do not underestimate the power that you have as a physician to instill change, to make a difference. You make a difference in your patients' lives every day. You can also and will also make a change in our community. Thank you very much, everyone. Have a wonderful night. And yeah, we hope to hear from you.